The United South and Eastern Tribes is battling addiction through connection. Our environments cultivate our communities, and our communities nurture our health. The differences in the rates of health conditions and the health status between groups of people are commonly referred to as health disparities. Most health disparities affect groups that are marginalized because of socioeconomic status, race, ethnicity, sexual orientation, gender, disability status, geographic location, or some combination of these. People in marginalized groups not only experience worse health, but also tend to have less access to or conditions that support health. Social determinants of health are life-impacting resources, such as food supply, housing, economic and social relationships, transportation, education, and healthcare. The distribution of these resources effectively determines length and quality of life. The disparities in health status are broad, persistent, and increasing. Research documents that these social determinants of health, such as poverty, income inequality, poor quality of life, racism, sex discrimination, and low socioeconomic conditions, are the major risk factors for ill health and health disparity. Conditions such as polluted environments, inadequate housing, and lack of educational and employment opportunities are implicated in producing inequitable health outcomes. These disadvantages are interconnected and intergenerational, and associated with a lower capacity for a full participation in society. There are great social costs that arise from these inequities, including threats to economic development, democracy, and the social health of a nation. When inequities are high and community assets are low, health outcomes are at their worst. When inequities are low and community assets are high, health outcomes are at their best. Did you know that departments within your tribal nation are collecting data on social determinants of health? When the data from all the different departments can be combined into one database, powerful information can be discovered to reveal community strengths and weaknesses. For example, people who overdose on opioids are more likely to have past arrest, depression, and have been assigned a caseworker. Do these various departments, health, criminal justice, social services, all work together to address these concerns early? The USET Epidemiology Center can examine this database to determine what specific social determinants of health are positively and negatively impacting your community. With stronger data and more effective reporting, grants will be strengthened and programs can be more targeted to effect change. A healthy community is determined by more than your health department. Through multiple departments connecting and sharing data, solutions to problems such as the opioid crisis can become more visible. For more information on how your departments can connect to benefit your tribal nation, email the USET Epidemiology Center.